folks. I'm here to speak onto a couple of issues. I'm happy to respond to the public health press conference that was made. We also did raise some of the very sensitive questions around patients being transported out of province from ICU. To me, it's important to ask a number of accountability questions on the unfortunate passing of one of these patients. My thoughts are with the family, and so I want to bring that issue forward in a good way. But we've also been speaking to other families, and to be straight up, these families want to be with their loved ones. They want to be closer to these loved ones who are out of province. It was not expected by these folks that their loved one would be taken out of province, so that's why I did ask the Premier today if the government would be willing to cover costs for travel, if it's safe to do so, of course. So hopefully we would see the government step up, because again, it's because of the healthcare crisis that's arrived out of political decision making that we have had to transfer people out of province. It seems to me that the government should therefore step in and provide some assistance to these families to ensure that they can be there to offer the moral and emotional and sometimes direct physical support to these folks during their recovery, because again, we know that that helps people bounce back from challenging times. I also did want to reiterate the message that we shared today about the impact on critical care. Right now, we know we're in this crisis when it comes to the ICU beds. We're asking the federal government to swoop in and provide urgent assistance. It's all really a staffing challenge that we're facing right now. But the information that we revealed today makes it very clear that the staffing shortage we face in ICUs now is a result of political decision making. 2 years ago, there were more ICU nurses working than we have today. It was the cuts of the Pallister government that led to there being fewer nurses. And let's keep in mind, this figure that we released today, that cut from 295 down to 283, these figures that we released today, that was after the second wave. So this government had already seen the impact that the second wave had on intensive care units and the staff who run them, and still they declined to make the needed investments to, first of all, undo the damage of their cuts, or to get critical care staffing level to the level that it should be. So for us, that's a very, very damning indictment of the situation that's befallen the province. It's because of political decision making. It's one of the major factors.